All right, imagine doing your job day after day, as always, but on payday, you don't get paid. How would you pay your rent, your electric bill? Well, that's what hundreds of Maine healthcare providers, therapists, optometrists, chiropractors, and more say is happening. They say one of the country's largest insurance providers, Anthem, has left them hanging. It's a story we first told you about in October. And Chris, you've been digging into this. What went wrong?
Well, Amanda, since our first story, we've heard from dozens of healthcare providers, including two of Maine's largest hospital systems. They're all bringing up the same issue, a delay in payments, which means they are struggling to pay their own bills. Now, our state's Bureau of Insurance is looking into the problem. So how does this affect you? If Anthem's not paying your doctor and you use Anthem as your health insurance, your doctor may be less likely to take you in for an appointment or keep you as a patient.
And all of a sudden, it was almost like a shoot of like hundreds and hundreds of piles of letters from Anthem.
Rosemary McCullough is one of the hundreds of therapists waiting for her money. One of her partners had been out tens of thousands of dollars for months.
So this person's had no salary for several months.
No salary?
No salary, except for self-pay patients. And then when we started talking to other people, we realized, in fact, there's up to hundreds of people being affected by this. It's not a problem on the end of the provider.
In June of this year, Anthem posted on its provider communications page for Maine that it was upgrading one of its billing systems in July. It's called a provider data management system. A healthcare provider, like a therapist, puts their unique ID number into the system to make sure they get paid for the patients they see. That ID number is called an NPI, a National Provider Identifier. Anthem said the new system would improve provider data accuracy and transparency, as well as enhance the provider experience and provide more accurate pricing and processing. The insurance company said that new system would launch in August. It warned users that those NPIs must be put in correctly or the claims would be denied.
Rosemary and other coworkers say they paid close attention as they submitted claims and still got denied.
We have a contract with Anthem that we will be paid. We have not been paid. It's been months.
Therapists like Rosemary have spent hours on the phone trying to get all these claims resubmitted and paid. Some, like QUYNN Morehouse, had to hire her own billing specialist to take care of it all. She says nearly 90% of her clients have Anthem insurance.
For myself, I do my own billing, but this just felt way above my level of expertise.
It's the number one issue that I have. It's a constant, 30 to 40 emails a day just on the Anthem issue right now. This is just basically a week.
It's not just therapists. Maine chiropractors, optometrists, physical therapists, and even two of Maine's largest hospital systems, Maine Health and Northern Light Health, all say they've experienced issues with getting paid on time or at all. We are hopeful that Anthem will respond to the urgency of this situation in the very near future and provide financial relief to all who have yet to be reimbursed for their services, wrote a Maine Health spokesperson. Even New Hampshire's insurance department confirmed similar problems. In an October communication to providers, Anthem acknowledged the delays, saying these delays are due to several factors, including hiring challenges related to the pandemic and a new provider data management system. We sincerely apologize for these delays. We strive to process and pay claims as quickly and efficiently as possible. Anthem said it prioritized claims from Maine, sent extra resources, and hired more staff to help Anthem workers in Maine deal with the problem.
Something this important should have been better communicated, and I think that's a fall down on their part.
Robert Reed is the executive director of the Maine Chiropractic Association. He has worked for several insurance companies, including 10 years at Anthem Blue Cross.
There's no consistency in how they process the claims. I can take a provider providing the exact same service over 8 different visits, and 3 will be paid and 5 will be denied. And that's the frustrating part for our providers, is they're doing exactly how they're told to do.
Anthem declined to do an on-camera interview, but sent us this response. We have been and remain in close contact with the Bureau of Insurance on this matter. We apologize for any delays this may have caused. Now, the Maine Bureau of Insurance is involved because of how widespread the issue is.
When it's broader than that, we do have an interest in that because it has an effect on consumers.
The effect on consumers? Providers may stop accepting Anthem insurance, meaning people will have to pay out-of-network rates or out of pocket.
Will you continue to have a contract with Anthem?
Great question. We'll see what happens. We'll see what happens from here on out. This cannot continue. This has to be fixed.
Now, these therapists we spoke to say they were nervous to come forward, concerned about what would happen if they did. Now, since we interviewed them, some of them tell us they're starting to see large amounts of their claims get paid back. One of the therapists we talked to in October says he got a call from Anthem this morning, promising him at least a partial payment today. Anthem says over the last 12 months, it has processed 92% of claims within 2 weeks and 97% of claims within a month. But this does not stop at the provider level. It could affect you, the patient. We'll explain how after the break. Before the break, we told you about how hundreds of Maine's healthcare providers, like therapists, optometrists, chiropractors, and physical therapists, are missing thousands of dollars in payments from Anthem Insurance. This problem also affects you, the patient. Anthem is one of the largest insurance providers in our state. And now, clinicians we spoke to say they are reconsidering taking Anthem altogether.
A lot of people said, you know, if things don't get better, or if I don't get paid, I'm going to have to leave the network.
Maine's caregivers have a tough decision to make.
We don't need to accept Anthem, but we do as a courtesy to the patient.
See patients who have Anthem insurance and risk not getting paid?
We're all in the same position, so they'll end up having to pay out of pocket.
Or force patients to pay more. A choice between caring for people in need and paying their own personal bills.
Unfortunately, the members are now being affected.
Clinical psychologist ROSEMARY McCullough says she tried to fix the issues behind the scenes to protect her patients. When she got nowhere, she told her clients what was happening. She says those clients started calling Anthem.
Now saying, hey, you're our insurance, you're supposed to be paying our providers, now we can't seek mental health services, we're gonna have to drop and pay our provider back.
Patients could be on the hook for hundreds or even thousands of dollars worth of visits.
This is unaffordable for people, for a lot of people who already have insurance, who are paying for their insurance. It's not affordable for them to also be paying for what their insurance should be covering.
Dawn ASCANIO and a group of therapists surveyed 70 of their peers across the state about this issue. This is how they answered.
I'm unable to currently pay my bills. My credit score is decreasing. I don't know what to do. I've never experienced this in my practice or in my life. Honestly, I got so upset and distressed this summer, I had to take time off from work. I had to use my home equity loan to pay bills. Another person said, it's turned my life upside down, to be frank. I'm in jeopardy with my mortgage bills due to non-payment from Anthem, and Anthem carrying most of my caseload.
They say the hassle they've gone through to get Anthem to pay them is compromising the care they give their clients.
Limit taking on new clients, to postpone client sessions, and to do less frequent sessions with clients, because just out of desperation to kind of stop the bleeding, they had to make more room in their schedule to see clients that they could get paid for. When we are having to spend all this extra time that we're not getting paid for to fight to get paid, it's less time that we can follow up on client issues or communicate outside of session.
The issues stem from a change in one of Anthem's billing systems. Essentially, providers say the new system does not recognize the ID numbers of those who have accepted Anthem for years, but they don't understand why. The company said it's working to prioritize Maine's claims and sent extra resources to help expedite the process. Anthem did not provide anyone for an on-camera interview.
Everyone is hurting in this, not just the providers and the practices and the small businesses, but the people that need to seek treatment.
Anthem is one of Maine's largest insurance providers. All state of Maine employees use Anthem, unless they're on Medicare. That includes workers in all 3 branches of Maine state government, as well as school teachers, Maine Turnpike Authority staff, and state police. Tens of thousands of people.
We sort of started realizing that the Anthem payment problem was much more widespread than we originally thought.
Dawn's survey of fellow therapists found nearly 75% are ready to leave Anthem or have already done so. That means people who want to see these providers either have to pay higher costs or find someone else.
We have the phone ringing off the hook with wait lists.
I wouldn't say any is really accepting new patients.
Nobody.
No one.
There's already a shortage of mental health providers in the state of Maine.
The wait lists are long, sometimes months. These are clients that aren't choosing to leave. They're kind of being forced out of the relationship possibly when they don't want to or they're not ready to and they're maybe more fragile, and then having to navigate that system.
People then have to scour the internet for the slim number of available therapists or other healthcare providers available.
If you're a patient and you're in rural Maine, get outside Portland, Lewiston, Bangor, Waterville, Augusta, there are very few options for doctors already. What if some of them stop taking that coverage? Are we going to ask patients to travel further for care? That could happen.
That's why Maine's Bureau of Insurance is now involved, performing a market conduct exam to figure out why this is happening and how long it will take to fix it.
And we're going to go in and look at what happened, make sure they're fixing it, and make sure it doesn't occur again.
Maine law says if a provider submits a clean claim that does not get paid within 30 days, the insurance company has to pay interest on that claim to the provider. On top of that, the Bureau of Insurance is making sure all insurance companies have enough mental health providers to meet consumers' needs.
We're here to protect consumers, and anything that affects that, I take seriously.
Patients and providers can have some hope. Some of the therapists we've spoken to say they're already getting paid the money Anthem owes them. Others are waiting, hoping to avoid having to make that very tough decision.
That is what breaks my heart when I think about going out of network with Anthem is the clients that I've already formed those relationships with.
I've been following this story for about a month now. As we said, some of the providers say they're slowly starting to get payments, but others are still waiting. While they wait, we're hearing from more and more of you about how you're affected by all of this. Johnny from Eddington reached out to us just this afternoon saying he's been rejected by a provider recently over this issue. And another viewer, Steve, told us his dentist and optometrist have both stopped accepting Anthem plans, so he'll be ending his Medicare Advantage coverage this year. Now, we're already hearing from some providers, including the Maine Optometric Association, who says its doctors will not deny care to patients with Anthem. There will be more developments to this story, and we promise to stay on top of them for you. In the meantime, you can see all of the coverage on our website and mobile app.